escape. Gets in his car and drives her away, far from all the things that we are. Puts on a smile and breathes it in and breathes it out. He says bye bye, bye to all of noise. Always says bye bye, bye to all of noise.
Good evening, everyone. My name is Kelly. I was asked by Jocelyn to do this video, and I figured I'd give you a nice background for it. I am a retired dancer, but currently I work as a physician. I'm board certified in physical medicine and rehabilitation with a second board certification in sports medicine. Please don't mind my notes here. I'm a little bit nervous. So in general, the patients that I see are patients with musculoskeletal issues, so bone, joint, connective tissue disease, although I also see a lot of patients with brain injuries, patients who need neurorehabilitation for diseases such as stroke, ALS, multiple sclerosis. I see patients with spinal cord injuries, amputees, and in my free time, I do volunteer as a dance medicine physician at a clinic in Seattle in order to give back to my dance community. Unfortunately, that clinic is on hold, given we're kind of at the epicenter of the current situation. And I was asked to discuss about the importance of staying active during this extremely stressful time. And I'm still very busy with work, unfortunately, as you can imagine. Even though a lot of my patients, we can do telephone calls, I still have some patients who still need me and need to see me. So unfortunately, I'm not as able to be as active as I would like to be at all the time. But if you, for example, find yourself with more time on your hands than usual, then I encourage you to, if you're not a generally active person, to start becoming active. And if you are very active, then keep moving. So I don't have to quote medical studies to prove to you the mood-boosting effects of exercise and movement. Physical activity, unfortunately, is very prevalent and is associated with poor health outcomes. The percent of time that humans in general are spending sedentary is increasing all around the world. There are even studies that show that extended sitting can also contribute to poor health and can increase your risk for diabetes, heart disease, as well as cancer. There are many benefits of exercise and staying active. Increased mood is certainly something that we could all use at the moment. For weight-bearing exercises, meaning anything that is weight-bearing, that's basically not in a pool or in some kind of anti-gravity treadmill, can increase bone mineral density and decrease your risk for osteoporosis, which is a thinning disease of your bones, and can also improve your cognitive function, so the way that your brain's ability to think and work. Regular exercise is also associated with improved sleep, reduced stress and anxiety, and lower risk of depression. It is also associated with fewer falls and fall-related injuries, particularly in older adults. There are some small risks associated with exercise, the most common being musculoskeletal injuries, meaning injuries to the bone, ligaments, muscles. Especially if you exercise a lot, you have a risk of overuse injuries. There are some less common but serious complications of exercise, including abnormal heart rhythms and heart attack. However, the benefits vastly outweigh the potential risks, especially in overall healthy individuals. So what can you do to stay active, but in this period of social distancing? If you want fresh air, and if you're lucky to live somewhere beautiful, as I'm very fortunate to, You can go on a walk, you can jog, you can run, you can bike, as long as you adhere to the CDC, the Center for Disease Control recommendations of 6 feet of distance between you and other people. If you are binge watching a lot of TV shows, which I've heard that a lot of people are doing currently, in between shows or in between commercials, do something active that you normally wouldn't do. In between a certain set, you could do 30 push-ups, 30 sit-ups, 30 jumping jacks, something like that. Something where you just keep your body moving in between those more sedentary periods. If your gym or the place where you work out is closed and you miss the communal aspect of taking class, YouTube has a wide variety of free workout channels for all levels of exercise and also different levels of fitness. So if you live in an apartment and you can't jump, there are no jumping exercise videos so that you don't disturb the people beneath you. There's so many yoga channels. One of my favorites is Yoga with Adriene. If you have some kind of disability or decreased ability to move around a lot, there are also seated exercise programs. So there are dance classes, obviously. There's all kinds of different things that you could do safely within the confines of your home. Also, play with your pets. Run around with your dogs. There's a lot of different kind of enriching activities that you and your pets can do together. Sometimes it's hard to find the motivation, so having an accountability partner can be very helpful, whether that is your spouse, your partner, family, your children. You can even FaceTime your friends and plan a time to do a workout together. Particularly if you're going to use this time to learn something new or try something new, I encourage you to ease yourself into a new activity so that you don't hurt yourself. So for example, if you've never done yoga, don't take a 60-minute advanced yoga class on YouTube. So try to kind of ease yourself into something different. The American College of Sports Medicine guidelines for exercise are 30 to 60 minutes of moderate exercise per day. Moderate looks different for every single person, but the recommendations are to be moving at least 30 to 60 minutes a day. That totals about 150 minutes per week, which may sound like a lot, but I know a lot of you may have some extra time on your hands right now, so take this opportunity to ramp up your exercise program, and hopefully after all of this is over, you can continue with that, and I hope you find something that you really enjoy that can give you some joy during this difficult time. So take this opportunity to care for yourself by taking care of your body, and have fun and do something you love. Please stay safe and stay well during this difficult time, and remember, movement is medicine.